I've gathered my supplies, made sure they weren't expired or opened. Knock knock. Hey Ivy. My name's Caitlin, and I'm going to be your nurse today. Provide some privacy. Can I set this down at the bedside?
Yep.
Alright. Do some hand hygiene. How are you doing today?
I'm alright.
That's good. Okay, and then can you go ahead and verify your name and date of birth?
Yep, Ivy Armstrong, 3964.
Alright, and do you have any allergies?
Just latex.
Okay, you shouldn't be using any latex, so you should be fine. And go ahead and raise you up a little bit. Okay, and today we're going to be doing a Foley catheter, and it's going to be inserted so you can get some of the urine out. I'm going to clean off my station first, actually. Do you have any questions about the insertion, Ivy?
I don't think so. I've had one before.
Okay, perfect. Wipe down the bedside a little bit. Alright, and I'm going to change gloves. Supplies over here, and I'm gonna go ahead and remove your bed sheet and expose you a little bit, but I'll try to keep it as little as possible. Alright, and I'm gonna move you into a Frog's position so we can insert the catheter. Alright, I'm just going to put this leg strap on so we can hold the catheter in place so it doesn't move anywhere. Sorry about that. Okay, and then I'm going to set my supplies down here. My sterile gloves. I'm gonna use this for a little trash can at the end of the bed if that's alright. Like this. And did you want me to go ahead and clean your area? Or can you do it yourself?
I can do it myself.
Alright. Okay, so I'm gonna let you do that and I'll be right back. Exit room. Let her do their thing. Come back in. Alright, are you all done with that, Ivy?
Yep.
Alright, sounds good. Okay, and then I'm going to change out into my sterile gloves for this. Hand hygiene again. Okay. Only touching the outside borders. You put this first one on, only touching the inside. Roll that over. And then use my sterile glove. Alright. Now we can open our materials. Open our materials. Open this up. And then I will give this some privacy. This. Alright, and then this is gonna go cover you up underneath you. Be sure to only touch the 1-inch borders. And can you go ahead and lift up your butt real quick?
Yep.
Thank you. Alright, and then now I'm going to change out to another pair of sterile gloves. Do hand hygiene again, just so we're not getting anything dirty. Alright. Okay. Only touch the 1-inch borders, so I will not do that next time. Alright, and my first glove, only touching the inside of the glove. This one. Gloves are a little bit tight. Don't touch the outside of the glove. Okay, and then I'm going to use the sterile hand to grab the other glove, put that on. Only use the outside to touch this one. Just drop that. Alright, there we go. Okay, so we're gonna put, well, 1 second. Okay, so now we have this. I don't touch anything. So we would use iodine to clean the peri area, but can't use that on the mannequin, so we'll put that in here, put that in here, and then we would also use this lube on a real person, but we can't use this on the mannequin. So we're gonna put that in there, and then we're gonna put the lube. Obviously this is not sterile, but spray that in there. And then we'll put that over there. And now I'm going to take this off. Get that all wet in the lube. Okay. And now I'm going to put solution in here. Make sure that's all ready so it can be inserted. Alright, and now I'm going to clean your peri area with these swabs. Okay. And 1, 2. Up to down, dispose of that one. Up to down this way, dispose of that one, and then up down in the middle. Alright, and dispose that. Okay, so now we're gonna insert the tube. And can you go ahead and take this out? And I'll leave that in for now. I'm gonna go ahead and insert the tube. I shouldn't have taken my hand off, so I would re-glove, but insert the tube. 1, 2. Okay. And then I'm gonna go ahead and get the balloon going. Any pain, Ivy?
No.
Alright, perfect. Out a little bit more. Take it out. It's too far in. There we go. Okay, still too far in. Take it out a little bit. There we go. Okay. So definitely sterilize. Okay. Take this syringe off. And I would go ahead and put this inside here. Alright, so that holds that in place. Then we're going to go ahead and take this and put it on the bedside. Alright, and then we're going to go ahead and collect a urine sample, if that's okay. We're going to have to clamp this.
Perfect. In an ideal situation, we'd probably have to pump on the other side, but we don't have an outlet over there, so
I'm going to clamp this.
we'll go ahead and start over here.
Alright, so we can get the pee out, take my syringe out. And before I insert that, get an alcohol wipe and clean off the port. So it's still sterile. 29, 30. Throw that away. This, collect a pee sample. Okay. Draw from that. Take this off. Put this sample in. Syringe over here. And then we're going to name, date, and time this. Send that off to lab. And now I'm going to clean up my station a little bit. And so I can get you repositioned. So you're not uncomfortable. There you go. Okay, and then I'm going to take off my gloves. Okay, and gather all my supplies. Send this off to lab. There we go. Then I'm going to perform hand hygiene and IV if you have any issues. Actually, I'm going to bring you back home. And if you have any issues, you have your call light in your hand. And how's that feeling?
I feel fine.
Okay, perfect.
How are you feeling, Abby?
Hand hygiene.
Almost done.
And definitely let me know if you need anything or if it feels really uncomfortable down there. Alright. Now I'll check on you in a couple hours. Bye, Ivy. Exited room, document my findings, make sure that they know she has a catheter in, and done.